Hello, and welcome to our basic cross-sectional anatomy presentation. My name is Jane D'Imperio, and I'll be walking you through this presentation. But before we begin, I just wanted to give you a brief introduction. So I'm a current radiology preprocessor, or RP, and I recently completed this course and many hours of initial training, and I'm now going through the workflow completely virtually because of the pandemic. So it's definitely been a bit challenging at times, but what I can say is that the more you practice reading CT scans and understanding the workflow, the better you'll become. The more accurate you'll be and the faster you'll be. So I'm definitely here as a resource if anyone has any questions, and let's get started. So actually, before we begin, I just wanted to briefly mention that when you're reading CT scans, the patient's anatomical left side is going to be on the right side of the screen and vice versa, just because of the way CTs are oriented. So here we see the thyroid lobes, right and left, and as you can see, the right thyroid lobe is on the left side of the screen. Okay, so then as we start from the top of the patient and move down, one of the first bone structures you'll see is the clavicle. This is the right clavicle with the arrow. And then on the other side, this is the left clavicle. And one of the common themes you'll notice in the human body is symmetry. So as we work through this presentation, you'll notice that many of the structures are mirrored on both sides. Okay, so then as we open up into the lung fields, you'll see the trachea. And then adjacent to the trachea is the esophagus. And then these are the left pulmonary artery branches. There's much more complex pulmonary artery anatomy. We'll actually have a separate presentation on that. So for this basic presentation, these are the left pulmonary artery branches. And then over here are the right pulmonary artery branches. Okay, and then this is the ascending aorta. And posterior to this down here is the descending aorta. And in between these two structures is the left mainstem bronchus. There's also a right mainstem bronchus over here, not as clearly visible in this image. Great, and then regarding bones in this view, the ribs surround the lungs. So you'll see that each of these structures, here's the one pointed out, are ribs. And then as we work our way down to the abdomen, one of the first major organs you'll see is the liver here. And one of the other first organs you'll see is the spleen down here in the right corner. And this is the left adrenal gland. The adrenal glands lead into the kidneys. There's also a right adrenal gland, not as visible in this image, but it would be right over here in this area, and it looks very similar to the left adrenal gland. Okay, and then as I said, the adrenal glands lead into the kidneys. So these are the kidneys. This is the right kidney over here, and then adjacent to it over here is the left kidney. Great, and then this is the pancreas. Specifically, this area right here that I'm circling is the pancreas tail, and then this is the pancreas body. There's also a pancreas head that would be over in this area where I'm circling, not visible in this image. All right, and then this is the superior mesenteric artery, and medial to the superior mesenteric artery is the superior mesenteric vein. And then lateral to those two structures is the gallbladder tucked over here in the liver. And this is the abdominal aorta. Posterior to the abdominal aorta is the vertebral body. And the vertebral body is surrounded on both sides by the psoas muscles, right here. Great. So that was, like I said, just very brief overview of some cross-sectional CT anatomy that you'll likely see on most of the scans you look at. And then regarding other views than the axial view, this is the sagittal view of the patient. We use the sagittal view to orient ourselves with the patient's spine. So specifically how we do this is we find the sacral region of the spine here, and then right above it is going to be the fifth L5. And then if we count up, so this is the lumbar, these are the vertebrae of the lumbar region, there's 5 of them. And then above it is going to be T12, so there's 12 thoracic vertebrae, and then we move up from there. And it's really important and helpful to orient yourself with the spine because it makes it easy to see injuries, deformities, and things like that. So this is something to get in the habit of as well. Great. So like I said, I hope that was helpful. It was a brief overview of some cross-sectional anatomy. If you have absolutely any questions or concerns, please reach out to us via our contact information on the website. A picture of the website's imaged below. And then after you feel comfortable with this information, the next step would be to complete the CT anatomy quiz. And you can complete that by reaching out to us, and we will set you up with a quiz. Thank you so much.